Your body communicates important signals when something is amiss, and recognizing these can be crucial for your well-being. Today, we will discuss 7 physical symptoms that demand your attention and should never be overlooked. These are the warning signs that healthcare professionals emphasize require prompt medical attention. No delays, no second guessing. This is not intended to instill fear, but to ensure your safety. Many older adults tend to postpone seeking assistance, often thinking it's trivial or feeling reluctant to inconvenience others. However, in numerous situations, early intervention is key. Taking action can prevent a small issue from escalating into a significant crisis. More importantly, being aware of what to observe empowers you to take charge of your health. In this video, you'll discover the 7 warning signs your body displays that experts advise you should never ignore. These signs are not vague. They are specific, tangible, and often time-sensitive. Stay with us until the end, as one of these indicators could potentially save your life or the life of someone you care about. Now let's begin with the first sign. Slurred speech or facial drooping. There is a distinct group of symptoms that healthcare professionals are adept at identifying right away, indicating a medical emergency that requires immediate attention. For instance, if you suddenly experience trouble speaking, with your words becoming jumbled or slurred, or if you observe that one side of your face is not moving as it should, it is crucial to seek hospital care without delay. The same urgency applies if you find you cannot lift one arm, or if it drifts downward when you attempt to do so. These are not symptoms to ignore. They are indicators that your brain may be facing a serious issue, as noted by a neurologist. Every minute a stroke goes untreated, you lose nearly 2 million brain cells. Time isn't just money. It's memory, speech, movement, and life itself. That's a hard fact and one that most people don't fully understand. In seniors, strokes can happen even without warning. You could be having a normal day, reading the newspaper, watching TV, eating lunch, and suddenly your words don't come out the way you intended, or your smile becomes uneven. These subtle changes may feel strange, but not scary, and that's what makes them dangerous, because when Guthunum smaast a fluber. When it comes to a stroke, timely treatment significantly enhances the chances of recovery. Take Robert, a 68-year-old Vietnam veteran, for example. One morning, while enjoying his coffee, he suddenly dropped the cup from his right hand and couldn't comprehend what was happening. He called out to his wife, but his words came out all wrong. She quickly noticed his crooked smile and immediately called 911. Robert received treatment within an hour and made an impressive recovery. He later reflected, "If she hadn't acted quickly, I might be in a wheelchair, or worse." The medical community utilizes the acronym FAST Face Arms Speech Time to educate individuals on identifying a stroke. Yet the aspect that often slips people's minds is the final letter T for time, which signifies that every minute is crucial. If you notice slurred speech, facial asymmetry, or sudden weakness, do not delay. Do not wait for a doctor's appointment. Contact emergency services immediately. Acting swiftly when your brain is in distress could preserve your ability to walk, talk, remember, and live independently. Additionally, sudden chest tightness or pain is one of the most urgent signals your body can send. Sudden, unexplained pain or pressure in your chest may manifest as tightness, squeezing, or even a burning sensation, potentially radiating to your arms, shoulders, neck, or jaw. While some individuals may attempt to dismiss it as mere heartburn or anxiety, the truth is that this could be a serious signal from your heart. This concern is particularly critical for older adults, as the signs of a heart attack can be subtle, slow, or entirely different from what one might anticipate. A cardiologist once noted the alarming number of patients who arrived too late due to these misleading symptoms. They believed it was just indigestion, but it's truly heartbreaking to think that if there's even a slight chance it could be cardiac, one should get checked. That statement carries significant weight, particularly when you realize that many heart attacks in seniors don't present with the intense pain often depicted on television. Sometimes it manifests as a dull ache, a fluttering sensation, or simply an awareness that something feels off. You might experience dizziness, shortness of breath, or sudden fatigue, even without engaging in physical activity. These are not symptoms to merely observe. They are signals to respond to. Consider Helen, a 74-year-old retired school teacher. In the afternoon, she experienced an unusual tightness in her chest while engrossed in a book. It wasn't unbearable, but it persisted. "I thought it might be gas," she mentioned, yet something urged her to contact her daughter. Her daughter hurried over and insisted they head to the hospital. Helen had endured a mild heart attack, but fortunately she received prompt treatment and fully recovered. "If I had waited, I might not be here," she reflected. Now she pays attention to her body. This was the lesson learned. When your body is in distress, it doesn't always shout. Often, it merely whispers. Heart trouble is no joke. Those whispers can serve as a crucial warning. Don't wait until it's too late. If you feel any unusual or persistent chest discomfort, especially with other symptoms, take action immediately. Don't hesitate or second-guess yourself. If you're still watching and finding this information helpful, please comment number 2 below to show your presence. And if you haven't subscribed yet, I encourage you to do so and turn on notifications to stay updated. Your support is invaluable to us. Keep producing valuable information to educate and motivate. Now let's proceed. Experiencing shortness of breath without exertion is significant. There's a clear distinction between recovering your breath after physical activity and struggling to breathe while at rest. If you notice yourself gasping for air during a calm moment, whether reading on the couch, watching TV, or lying in bed, it shouldn't be ignored. Sudden shortness of breath without any substantial physical activity can signal serious health issues, such as heart failure, pneumonia, or a pulmonary embolism, which is a blood clot in the lungs, all necessitate immediate medical attention. A respiratory specialist once remarked that if breathing becomes difficult for no apparent reason, it's your body signaling distress. It's not merely age or fatigue, it's a plea for assistance. This statement resonates particularly with older adults. As we age, our lung capacity naturally diminishes, and our heart exerts more effort to circulate oxygen-rich blood throughout the body. However, distinguishing a typical sign of aging from a medical emergency hinges on how, out of nowhere, it hits you, and the intensity escalates if you're gasping for air after just a short stroll, or if you wake up feeling breathless. Clearly something is amiss. It could be related to your lungs, your heart, or perhaps both. Delaying action might lead to more severe symptoms or permanent harm. Consider Walter, a 76-year-old retired electrician. He had always maintained reasonable health, yet one evening, while enjoying his favorite program, he suddenly felt an overwhelming sense of breathlessness. There was no chest pain, no fever, no exertion, just this unsettling feeling. An intense feeling of breathlessness prompted his daughter to urge him to seek medical attention at the hospital, where they discovered a small blood clot in his lung. "If I had waited until morning," Walter remarked, "I might not have woken up." The takeaway is clear. Shortness of breath should not be something to observe for later. It demands immediate action, particularly when it appears suddenly, escalates rapidly, or turns even basic activities into a struggle. Listen to your body. It can sense when something is wrong, even if you can't pinpoint exactly what it is yet. If breathing becomes challenging without explanation, don't hesitate. For a clear reason, head directly to the emergency room. It's preferable to discover it was nothing rather than realize too late it was something significant. Watch for signs of unusual confusion or sudden disorientation. When an older adult suddenly becomes confused, forgets familiar things, or seems disoriented about their surroundings or the time, it's tempting to attribute it to aging. However, that kind of mental fog that arises suddenly, especially if it's unusual for them, is one of the most critical warning signs. It could indicate a stroke, a brain infection, or dangerously low oxygen levels, or even a severe reaction to medication, and each of those scenarios necessitates prompt medical attention. A hospitalist once noted that in older adults, the brain frequently serves as the initial organ to indicate trouble. Sudden confusion acts as the body's emergency signal. This insight is particularly crucial, as many seniors and their families may fail to identify confusion as an emergency. They might perceive it merely as fatigue or a rough day. However, when the change occurs abruptly, such as forgetting names or becoming disoriented in familiar surroundings, communicating in ways that lack clarity, it's crucial to address this matter seriously. These are not slow, gradual changes in memory. Rather, they are sudden shifts that frequently indicate a more profound issue. Consider Linda, an 80-year-old woman who had been living independently and managing her own affairs. One morning, her neighbor discovered her standing in the hallway of their building, confused about how she arrived there or the reason for her presence. Fully dressed, yet visibly startled, she repeatedly asked the same question. Her family speculated that it might be due to dehydration or fatigue, but when they took her to the hospital where she was diagnosed with a urinary tract infection that caused a sudden onset of delirium. After receiving antibiotics and fluids, she returned to her normal self within a few days. "I didn't know confusion could come from something like that," her daughter remarked. "Now I'll never ignore it." That's precisely the kind of outcome we hope for. The brain is sensitive, and in seniors, it often reacts to other issues like infections, lack of oxygen, or even blood sugar changes before anything else does. When confusion arises unexpectedly, don't just sit back and hope it resolves itself. It might, but if it doesn't, or if it escalates, the outcomes could be permanent. If you're still engaged with this video and appreciating these insights, please comment number 4 below to show your presence. If you haven't subscribed yet, I encourage you to do so and activate the notification bell to stay updated on our latest videos. Your support enables us to keep producing valuable content to inform and inspire you. Now, let's proceed to sign 5, severe or sudden. Abdominal pain is something we all encounter occasionally, particularly as we age. However, when the discomfort is sharp, sudden, or intensifying, especially in the abdominal region, it should not be overlooked. Severe belly pain may indicate a medical emergency, such as appendicitis, a perforated ulcer, pancreatitis, or even internal bleeding. In older adults, abdominal pain can also suggest a blocked intestine or a ruptured organ, both of which can pose serious risks if not addressed promptly. A trauma surgeon once explained that when a senior reports sudden abdominal pain, it is taken very seriously because time can be the deciding factor between a treatable issue and a life-threatening one. This perspective is crucial, as seniors face a higher risk of complications, and the typical signs of illness may not manifest in the usual manner. You might not exhibit a fever or noticeable swelling. Instead, you could simply feel unwell or experience sudden, intense pain. Regardless, your body is signaling that something is wrong, and it's important to pay attention to those signals. It's important to share the story of Frank, a 72-year-old widower known for his toughness. One evening, while wrapping up his dinner, he experienced a sharp pain in his lower abdomen. Thinking it was just gas, he took some antacids and went to bed. By morning, the pain had intensified, leaving him too weak to stand. His daughter called for an ambulance, and the ER team discovered a twisted section of his intestine that had cut off blood flow. Emergency surgery ultimately saved his life. "I thought it would pass," Frank later reflected. "I didn't realize how quickly things can deteriorate." That narrative is quite familiar. Older adults frequently minimize their discomfort or hesitate to seek help, hoping the situation will improve. However, when the pain is severe, ongoing, or different from what you've experienced before, it's crucial to take action rather than endure it. Being cautious won't cost you anything, but delaying could have serious consequences. If you experience significant abdominal pain that lingers, particularly with symptoms like nausea, vomiting, or dizziness, it's essential to avoid speculation or online searches. Instead, seek medical attention promptly, especially if there's persistent vomiting or blood in your vomit, as occasional vomiting is not the same. Experiencing vomiting from spoiled food or a stomach bug is uncomfortable, but typically resolves itself. However, when vomiting persists for hours, or if blood is present, it escalates from a minor annoyance to a significant medical issue. Ongoing vomiting can result in severe dehydration, electrolyte imbalances, and even kidney problems. The presence of blood, regardless of the quantity, may indicate a more serious condition such as bleeding in the stomach, a torn esophagus, or ruptured ulcers. A gastrointestinal specialist once remarked that blood and vomit is never a trivial matter. Typically, it's one of the quickest methods we use to detect internal bleeding in older adults, which should certainly grab attention. Many individuals tend to dismiss or misinterpret it. The blood might show up as bright red or resemble coffee grounds, dark and grainy, both of which indicate that something is amiss within the digestive system. For seniors, this could stem from reactions to medications such as anti-inflammatories, complications from undiagnosed conditions, or even stress-induced damage to the stomach lining. Consider Evelyn, a 79-year-old woman who had been using over-the-counter pain relievers for her arthritis. One night, after dinner, she began to vomit. Initially, she attributed it to the shrimp, but when she noticed dark flecks in the sink, which she thought were remnants of old food, her grandson insisted on seeking medical help. At the hospital, doctors confirmed she had a bleeding ulcer that had been developing silently for months. "I had no idea it was that serious," she admitted. "But if I hadn't gone in, I might not have lasted another day." This serves as a crucial reminder. Experiencing blood vomiting is not something that can wait until morning. It's not an issue to sleep off or remedy with ginger ale. It indicates that something in your body is malfunctioning and leaking where it shouldn't. Whether it's a damaged stomach, liver complications, or a burst blood vessel, only immediate medical attention can identify the cause and address it promptly. If you're still watching this video and finding these insights helpful, please comment number 6 below to let me know you're here. And if you haven't subscribed yet, we encourage you to subscribe and activate notifications so you won't miss any of our videos. Your support enables us to keep producing valuable content to inform and inspire you. Now let's proceed. A high fever accompanied by a stiff neck and sensitivity to light can indicate serious health issues. While a fever typically signals that your body is combating an illness, if it is severe and paired with symptoms like a stiff neck, headaches, confusion, or sensitivity to bright lights, it could be a sign of meningitis, a potentially life-threatening inflammation of the protective layers surrounding your brain. The spinal cord and meningitis are often associated with younger individuals, but older adults, particularly those with compromised immune systems or existing health conditions, are also at risk. When meningitis strikes this demographic, it can progress rapidly, making it critical to act swiftly. An emergency physician once emphasized that if an older patient presents with a fever and exhibits neck stiffness or sensitivity to light, immediate attention is paramount. This level of urgency is significant because by the time these symptoms manifest, the infection may already be well established, leading to severe stiffness. In the neck isn't merely discomfort. It's your body signaling that the lining around your brain is inflamed. The light sensitivity isn't just bothersome. It's an indication that your central nervous system is under strain. For some, it also brings nausea, vomiting, or a sensation like their head is going to burst from pressure. None of this should ever be brushed off as just a bug. Take Jerry, a 75-year-old widower and avid crossword puzzler. One morning, he couldn't complete his daily puzzle due to a severe headache, and by afternoon, his neck was in pain. He struggled to look down, and the light streaming in from his kitchen window felt overwhelming. Fortunately, his neighbor, a retired nurse, noticed the symptoms and took him directly to the hospital. The doctors diagnosed him with bacterial meningitis, and due to the quick action, Jerry survived. "I thought I was just run down," he later remarked. "I had no idea it could be something so serious." This highlights the truth about our bodies sending out warning signals like fever, stiff neck, and light sensitivity. It's not an overreaction, and neither should you dismiss these signs. They indicate something significant is happening. When it comes to your nervous system and conditions like meningitis, every hour is crucial. Treatment is effective, especially when initiated early, so don't delay if you or a loved one exhibit symptoms. Avoid waiting for an appointment or attempting to sleep it off. Head to the emergency room and allow the professionals to handle it. Prioritizing your health is always a wise choice, while waiting could pose a risk that's simply not worth taking. By now, you should recognize the importance of heeding these signals. Your body communicates with you, and as we age, these 7 signs are not intended to scare you. Rather, they are here to empower you. Recognizing when to take action is not a sign of weakness, it is a demonstration of wisdom. This wisdom, particularly the kind gained from years of experience, highlights the importance of treating your health with urgency rather than delay. It's tempting to dismiss symptoms thinking, "I'll be fine," or "it's probably nothing." However, in many of the stories we've shared today, individuals were only saved because they chose to take action when they noticed the signs and reached out for help. Whether you drove to the hospital or found another way, those moments truly matter. Remember, taking care of yourself isn't solely for your benefit. It's also for your family, friends, and everyone who values your presence. Each day you remain safe and strong is a day they can appreciate your wisdom, your stories, and your love. So, cherish your health as the invaluable gift it is. Thank you for being with us today. We invite you to share your thoughts in the comments below. Tell us one thing you learned today and how you intend to incorporate it into your life. Your insights are significant. We welcome your thoughts, so feel free to share them. Your feedback truly motivates and encourages us. If you liked this video and found it useful, please give it a thumbs up, subscribe, and share. Your support enables us to keep producing quality content to inform and inspire you. Thank you for watching, and we can't wait to see you in the next video.